Best Practice Clinical Guidelines for Hospice and Palliative Care Patients. Home Medical Equipment Support Surfaces. Each year, $600 million is spent on home medical equipment for hospice and palliative care patients. It is estimated that $100 million is wasted due to inappropriate use. Patients selecting hospice or palliative care generally have different clinical outcome goals, which is a consideration in determining appropriate therapy and quality of life pursuits. While the Center for Medicare and Medicaid Services and private insurers have a small but growing list of indications for home equipment usage, the hospice and palliative industry is sorely lacking evidence-based guidelines for home medical equipment use. Historically, most healthcare professionals learn about home medical equipment indications for use from equipment vendors. Most of these vendors learn from home medical equipment manufacturers. While many equipment vendors provide a tremendous service, this methodology as a primary means of professional education can be incomplete and filled with bias. As a result, hospices throughout the United States have dramatic variation of utilization for specific types of equipment. For example, a hospice may have 50% of their patients using a specialized type of wheelchair at one location. However, at another location, no patients use this type of specialty chair. These dramatic usage variations within the hospice and palliative care setting force the question of defining appropriate utilization where clinical evidence is available. This presentation reviews evidence-based guidelines for using support surfaces in hospice and palliative care patients. The goal of this presentation is to provide nurses with updated knowledge and clinical skills for proper assessment and utilization of support surface use in long-term care and hospice. Upon completion of this activity, participants should be able to 1. Understand the categories or stages of pressure ulcers and their prevalence in hospice patients. 2. Understand what types of home medical equipment make up Group 1, 2, and 3 support surfaces. 3. Differentiate the clinical indications for using Group 1 and 2 support surfaces in treatment. 4. Articulate considerations for wound care at the end of life. Pressure ulcers or bed sores are injuries to the skin and underlying tissue resulting from prolonged pressure on the skin. Studies have shown pressure ulcers occur in 15 to 27% of home hospice patients. The most common wound location for these patients is the sacrum, representing 25% of all wounds.